Well, I'm here for the Society for Research on Nicotine and Tobacco conference, which is a big annual conference, which this year it's a joint conference between the sort of US and the European chapters of the SRNT, and it's being held in Edinburgh, which is wonderful. And so it brings together a lot of researchers in all aspects of tobacco and nicotine, research, policy, all sorts of things, great discussions and lots of presentations about what's going on around the world in tobacco control. We had a pre-conference workshop which Sheila Duffy, from CEO of ASH Scotland, was the chair of that workshop, and the workshop was all about the end game and how we might use research, what is the end game and how is it different from non-end game approaches, what are end game interventions, and how do we take end games forward. And so ASH Scotland through Sheila had a very, very integral part in that workshop. I guess the idea for endgame, it's been around for the last 10 or 20 years, and I suppose the thinking really was we've tended to be a bit sort of incremental in our thinking often in tobacco control. So we've thought about trying to reduce smoking and reduce the harm that it causes. And I suppose the endgame thinking is saying, well, we don't just want to reduce smoking, we want to more or less eliminate smoking and the harm that it causes, because it's an unacceptable thing. You know, we've known for 50, 60 years or so that it causes lung cancer and heart disease and stroke and all the other things. And yet we still tolerate quite a high prevalence of people smoking, big inequities in people smoking. You know, it's concentrated amongst poor and disadvantaged communities. And the reduction in smoking is often really quite slow. So the endgame approach is to say none of those things are okay. What we want to do is get smoking down to minimal levels as quickly as possible and equitably, so that all parts of the population. And if we think in that way, then we probably need to think about new measures which go beyond our normal approaches, which are quite, they're good approaches, but they're a little bit softly and incremental. So rather, we should go really for the big bang and say, right, what's going to make the biggest difference and do the most to help people who smoke at the moment to stop, and to stop young people from starting, and to do so really quickly. And those measures are often more structural in nature. So, and we distinguish them from business as usual measures, or BAU measures. And so I would say business as usual measures are often focused on the individual. And so it's things like smoking cessation support, which is a really good thing, and we should definitely do it. But it's not going to most people don't access smoking cessation support. So it's not actually going to bring about rapid, profound changes in prevalence. Or things like, even something like plain packaging, for example, really good measure, but it's not going to actually make a whole bunch of people quit. Whereas some of the measures, the end game measures that we talk about, are ones that are likely to have a really profound and rapid and equitable impact. And so one example of that is taking the nicotine out of cigarettes. And that makes cigarettes no longer addictive. It makes them no longer attractive for young people. They don't get a hit when they use them. So people who smoke are suddenly going to find their cigarettes are not helpful for taking away the cravings and so on. They're not going to be satisfying. And for young people, if they try these cigarettes, these denicotinized cigarettes, they're not going to want to use them again. They're not going to get addicted to them. So it's a really radical measure, and I think we shouldn't be afraid of radical measures, and that's because the situation is unacceptable. We want to get those people, almost all of whom want to quit, and really do something that will actually help them to quit quickly. And that's what endgame measures are. There's a whole suite of other measures. And that's what the endgame approach is, I suppose. It's about trying to get rid of smoking quickly and thinking beyond the measures that we usually think about so that we can achieve rapid reductions in smoking for everyone. I mean, I guess I'm sort of drawing a little bit on the New Zealand example because that's where I'm from. So we had proposed three measures. So one was the denicotinization, which I've just spoken about. A second one was massively reducing the number of places that sell tobacco. So in New Zealand we have about 6,000 places, which is probably similar to what the number in Scotland, I would guess, because population size is similar. And we were going to reduce that to 600, so a 90% reduction, so a really big reduction, not fiddling about by reducing it by a bit, but really reducing it by a lot. And the third measure was the smoke-free generation model, which has been proposed recently in the UK, and I think to apply to Scotland as well. And so that's the idea that you set a cut point where people born after a certain date can never legally be sold cigarettes. And that means it effectively it's a rolling, every year the age at which people are allowed to be sold cigarettes goes up. So in New Zealand we proposed those three measures. There are other ones as well, there are other endgame measures as well. And we thought that was a really powerful combination. Making the cigarettes no longer addictive, making them much less easily available, much less sort of in your face, if you like, in not present in every community, in every corner store and every supermarket. And thirdly, this thing about stopping young people from being legally sold cigarettes, and enhancing that each year, changing that every year so that those people would never be able to be sold cigarettes. So those are some examples of endgame measures. So what's happening in New Zealand now is we had those measures were passed by our previous government, so they went through Parliament in December 2022. And they were really all in place, and implementation was sort of underway. So retailers were being asked to apply to be one of the 600, and some of them were going to be chosen, not all of them. So it was all going along. It was all going to happen. And then we had an election, and we had a change of government, and we had a very different sort of government who decided that they did not want to proceed with any of the measures, much to our disgust, I suppose, certainly deep disappointment. And so the measures have been repealed, the legislation's been repealed, so they're not on the face of it going to happen unless this government changes its mind, or we get another government back, and the previous government, the parties have said that they will reintroduce these measures, so it's still quite possible that they will happen. And certainly we will be working towards that. But at the moment, they're not going forward. So there's always discussions about what are the best measures, and there's legitimate debate about that. Is denicotization the best measure, or is smoke-free generation, or is something else? And that, I think, often rests on the evidence. What's the evidence of likely effectiveness, possible unintended consequences, and feasibility, and so on. So there's those sort of considerations. But there's also the other thing that's possibly in the background is the tobacco industry and the role of the tobacco industry in all this. So in our experience in New Zealand, and this is, I think, echoed around the world, they vigorously opposed the three measures that were proposed. So they oppose endgame measures, and it's not hard to think why that might be the case, because it threatens their profitability, it threatens perhaps their very existence. So obviously they put it in our situation. We had a consultation process through Parliament, and they put in submissions to say that they opposed all these policies. But I think it goes beyond that. And what's happened in New Zealand is that the new government seems to be, at the very least, parroting, using the same arguments that the tobacco industry has used to oppose the measures. There's also suggestions that it may go beyond that there may be underhand influence. That's not proven, but there's certainly some signs that suggest that could be the case for some of the parties involved. So that's a real concern, that we've got an industry that obviously has an enormous conflict of interest, undermining what we think would be incredibly effective health measures, and doing so on the basis to protect their own profits and their own continued existence. So that's extremely unfortunate. So I think political will, ultimately, that's probably the final thing, because if you don't have for big national policy measures, you obviously have to have a government or politicians who are going to support those measures. So that's the ultimate decider about whether they go through. But there's a whole lot of things that determine whether that political will is there, and that can be the evidence. It can possibly be malign actors, I would say, like the tobacco industry. And then there's the effectiveness of the health lobby advocates and so on, who have been, by and large, in New Zealand, completely behind these measures. And the public, and we've been able to show there's really strong public support for all of these measures in New Zealand, but the government sort of is ignoring that, as far as we can tell. So it's flying in the face of public opinion. And I think that's generally the case with most of these tobacco control measures, both incremental ones and endgame ones. They usually attract a huge amount of public support, and I think that's true for many measures that have been implemented in Scotland and ones that are proposed, like smoke-free generation. There's opinion polls have been coming out showing there's lots of support. Because this is an international game, and I'm talking from a New Zealand perspective, but I think we should be very internationalist in this. It's good to see progress wherever it occurs, and if Scotland can lead the way on these things, brilliant. If it's Australia, or if it's Ireland or Canada or Germany or wherever, it doesn't matter, because wherever it happens, it sets a precedent. And that precedent tends to have a domino effect. And we've seen that with sort of smoke-free legislation, bringing in smoke-free bars and restaurants. They're very, very common now around the world, and Scotland and New Zealand were some of the first places to do that. And we've seen it with plain packaging and a whole load of other measures. So I think just to encourage the government of Scotland and the community of advocates like Ash Scotland, of course, to take things forward here, because it's not just important for Scotland, it's important for the whole world, and that's what we all want to achieve. We want to get rid of smoking and the awful effects it has all over the world.